corona surgeon wants him not to have anything
Okay.
because he's got the bad
Yeah.
splenic injury. And what else did you say? He's on bed rest.
Okay.
He's got K-Med ordered, okay? But as you look at him, you notice how pale and diaphoretic he is.
Hey, respiratory,
What's
can
his
you come in
labs?
here?
His hemoglobin.
His hemoglobin, he had a hemoglobin of, say, 10.5 in the ER. He has got no blood at this point.
Can you give me a 9 for breathing? Yeah.
Are there plans for getting that lab again?
Sure, in 6 hours, they'll repeat that lab, or sooner if you need.
What was his blood pressure? Is that one, so I'm
Okay.
assuming we're not
So
using
we're
the.
not
Okay.
using that?
Okay, so, yeah, suspend that and we'll, his heart rate is 136, his respirations are 32, his SpO2, how much O2 did you put him on?
2 liters.
Okay, so we'll say that his SpO2 is about 92. His blood pressure was 80/60.
The bolus.
Okay.
20 per kilo, I don't know how much it is. Or we did.
He's, he's 40 kilos.
Yeah, 600 bolus. Yeah.
So we want you actually to get the equipment you would need to do that.
I'll go get it.
Okay, alright, bye. Okay.
So we did our
You
idea.
said he's 7 years old?
He's 12.
12 years old, okay. Yeah.
He's an active, you know, just out riding his dirt, or his bike in the park. But wearing a helmet.
Good job wearing your helmet. She's a good mom.
Okay, is there anything else while we're waiting? Is there, talk out loud to us. Tell us what's going through your mind in terms of what you're thinking, what are the concerns that you have?
Could be bleeding out his spleens, but
Okay,
I know you already had his hemoglobin, I would maybe recheck again.
Okay.
See where that's at, I know we're gonna do the bolus, obviously our blood pressure's low.
okay,
Obviously we have the contusions, so we wanna make sure we're sitting him up high on that, and we said he's kinda, sounds like we're decreasing even though we're on 2 liters.
okay. Yeah, 'cause and off on room air, he was at 90. So
Okay.
his SpO2 was 92 or so on the 2 liters. Okay. Are you concerned? You said you thought he might be bleeding.
Yeah.
What are some other things you could look at to establish his perfusion? You know, if he were bleeding, what would you,
Pulses,
okay,
his gum line,
okay. So he's
Eyes.
pale all over. Okay, his heart rate is 136 and it's pretty thready. You can feel peripheral pulses, you can feel central pulses,
okay.
but they're thready. Okay. Anything else?
I'm gonna be cycling his blood pressure, just to
Okay.
keep an eye on that,
And how often would you cycle his blood pressure?
probably at least every 5.
Okay. So if you were concerned of his bleeding, what actions would you take other than caring for him? Is there anything else you would want to do?
Call the physician.
Okay.
Okay, Dr. Gozi, this is where I come in. Dr. Gozi is on call today and she's available at extension 4210. And
I want you to call her.
yeah,
Actually call her.
actually they called.
Okay.
You said 41.
4210.
Oh, yeah, they have to dial out from
Oh,
here.
sorry.
Up here, we always have to do 647
Okay.
in this tower.
Okay.
42.
4210, yeah.
When you have her on the phone, we're gonna have you just give a report, kind of report to her what you're proceed.
Starting the whole on speaker and actually.
Hi, this is Faith on Peds. I'm taking care of a patient who just got admitted from the ER in room 5126, 5027, my bad. McGuire Johnson, he's a 12-year-old male, who had a bike accident. He is on 2 liters and he was setting at like 92%. His blood pressure, is 80
80 over 50.
80 over 50. So we're about to give a bolus, but he's really pale. He has a splenic lac. So we were wondering if you could come in to assess him,
Or if there are orders.
or if there's orders. His hemoglobin, it was 10 in the ER, but he is super pale and our blood pressure is not low. Going for the ml bolus now. Repeat H&H, okay? 2 units of release Tacrolimus blood cells. Is there stat CT of the abdomen? Okay. Was did hear you have a token cost in the ER?
He, they did a type and screen, but it's not ready.
Okay. Okay, perfect. Okay. Thank you. Yep, bye.
Okay, so do you wanna repeat those orders again, so everybody's aware of them?
Sorry.
No, that's okay.
Saw her writing them down.
I'm just observing what you're
I
doing.
would have written them down, my bad. Originally I would have written them down.
Okay,
Repeat H&H right now.
okay.
A 250 ml normal saline bolus right now, and then reassess. And then 2 units of Packard blood cells unreleased.
Emergency.
Emergency.
Yeah.
And then to just keep monitoring him at this moment.
And stat repeat CT.
Yes, and stat repeat CT.
Okay, so we want you to carry out those orders, including getting the blood. I don't know, given the current situation on the unit, do we have somebody that can go to get the blood?
I'm not sure.
Okay.
Because I know one of the unit assistants went to lunch, which would move the other one, and that would pull her off the hook.
Okay, okay, so let's, we'll kind of play that by ear, but what would you need to get emergency release blood?
DV form.
Okay, and who would you normally send?
I could go myself or a UA. Go to get.
Okay? Given your role here in the room, what do you
I
think
would have
you
the
would do?
UA sent. Get it.
So the patient continues to complain of severe pain, skin is pale, cold and clammy, his abdomen is becoming a little more rigid, his, temperature now is 98.2, heart rate's 132, respirations are 28, pulse ox is 94, blood pressure's 84 over 60. Okay?
Okay. Have we given the blood yet or no?
Not yet.
Get it.
Mm.
Go get it.
Mhm.
Okay.
In the meantime, well,
So we need to go get lab supplies to get his lab. Yeah.
we want you to do exactly what you would have to do in this
And I
situation.
think I would call the doctor again about his blood pressure. We're probably gonna get a bigger bolus. So I actually have to do that.
Yeah, we have to do it.
So we,
I don't know how to.
Okay,
We have the stuff to do. The bolus was running initially, our initial bolus, but I don't think it was done before we even called the doctor.
so, but you gave 250 or about that? She
Well, we were
wanted
gonna do it.
250.
We were gonna do 20 mg per kg before we even called the doctor, but I don't think
Okay.
that even.
Okay.
Do that.
If you gotten 250 in, what would you normally do to evaluate that?
Check the blood pressure.
Okay, let's go back and reassess him. Okay? Okay?
Yeah.
Mm.
Okay. Doing the blood pressure and listening.
Hmm?
Listening.
Blood pressure is 78 over 45.
Okay, what about our heart?
Heart rate has climbed about 140.
I'm gonna do a assessment so the doctor can get in here.
Okay, what do you, talk to us out loud,
So
what are you
I-
thinking?
This is her first
So-
one. Push the
Okay,
staff
so
assist.
help her out here,
She's
guys.
doing a great job.
Uh,
We push the
Staff
staff
assist, so I can get
button.
orders right now, and I can do.
Okay, you have orders, what order have you not acted on?
The
That she
blood.
gave?
the
No,
blood.
the blood, but we
And the
can.
lab.
The CT.
The lab, the
And the
CT. Okay, so what do we need to do for the CT? Respiratory therapy, what do we need to do for the CT?
Well, we need to get an oxygen tank.
Yeah?
We need help in
Can
here.
you please go
Our
do
blood
that
pressure is
for us?
taking- You can't
Okay.
walk away.
Okay, so respiratory went to get your oxygen tank.
We need staff. Our blood pressure is tanking.
Okay. I got nurses supervisor on top.
Okay, so the next thing we're gonna try and do is,
That's just the TV.
what do you think the priority is at this point, Faith? What would you consider the priority?
Blood pressure right now, I feel like is.
Okay, you can certainly repeat a blood pressure, yeah.
We
and
need to
we'll
give him
continue.
more fluids
We need
because
more
we can't even go
fluids,
to
yeah.
CT if his blood
We're
pressure
not,
is
yeah.
dropping.
Okay,
I guess we can bolus on the way down. I got to let y'all do. What's his blood pressure?
78 over 40, 40.
I'll go in here and get that started.
You call your ICU and text them to stick him up to see if he needs pressures.
Is, Dr. Gozi coming or just we're
No, just
communicating?
over the phone.
Okay, so your trauma surgeon will meet you in CT,
Okay.
okay?
Okay, honey, you're gonna do a little pony.
Thank you for getting that.
You're welcome.
Okay. Okay, so how are you feeling at this point?
There's no focus.
We are working on a bolus, a 20 ml per kg bolus.
Okay,
So then he.
and I heard somebody say you were gonna call the intensivist for
Yes.
just some assistance.
Yeah.
Okay,
Notify the trauma docs who's ever on that his blood pressure was doing.
yeah, you could update the trauma doc, right? Okay. Okay, what have we not addressed in this whole scenario? Where do you think this is gonna go? Given what you know about him, what are you anticipating?
Surgery.
Okay, so what needs to happen before he goes to surgery? I mean, what would you normally do if you've got a child here without family going to surgery?
Call the family. Yeah.
Okay, yeah. Cause remember, mom left
Yeah.
to go home to
Yeah.
take care of kids, so she doesn't know any of this is happening.
Yeah, update her and tell her, get consent for the.
Okay, so our biggest concern is timely transport to CT and OR.
Yeah.
There's nothing you're doing in the room here that
Right.
could
Yeah.
make that any better.
Right.
So we're gonna suspend things here. We're gonna assume that he's on his way to CT and OR. But just for the practice, and you can do this jointly, we want you to show us a head-to-toe assessment that you normally would do if you had more time, right?
Yes.
Cause, you know, we're assuming it's coming from one spot, but let's
Yeah.
make sure nothing else is changing. So, Faith, I don't know if you wanna hand that off, or if you've been on this, in the spotlight, but you're doing a
Sure,
great
yeah.
job.
Yeah,
You are
you're
doing a great job.
Yeah.
But, don't hesitate to get somebody else involved. Okay, so let's do a head-to-toe exam on McGuire.
What? What did you come in for first though? Bike accident.
Trike, yeah.
Bike accident.
Yeah.
Yep.
He's a little bit sleepy. He does answer if you arouse him a little bit. Okay, he's pretty tender along that left side. He's got shallow respirations and his breath sounds are definitely decreased. His belly,
Yes, push on his belly.
his belly is, rounded and firm. It's extremely tender in the left upper quadrant.
So you could have acute abdomen, you could have any flat side.
Okay, and yeah, you do see that bruising.
Pulses up high, can't do pulses over here, you can try and go over. Pulses on your toes. Probably half breath. Yeah, we haven't done that yet.
Mhm.
She's back too. You look all over.
We really have to undress him anyway.
Well,
He's like, no. We lift him up, look at his back too,
Okay.
especially see how far that
sleepy, but he does arouse with more
Follows
stimulation.
commands, answers questions.
Yeah, with some,
I know the name's a
Stimulation.
little tricky, I
Yeah.
mean, I would be hard for me too. How are his pupils?
his pupils are equal and reactive.
You squeeze my fingers? Good job. Alrighty, and then can you push out my hands? Perfect, you pull back. Perfect. Into your fingers, wiggle your fingers for me. You'd be checking cap refill at the same time, make sure they're equal on both.
Okay,
What's wrong with his forearm?
he's got a distal radius fracture.
Just a radius fracture. So you'd wanna be checking, make sure he doesn't get Parkinson syndrome, anything like that, still has
Sure.
good cap refill, they're not cool or anything. Pull back against my arm. And then push down. And then this one kinda hurts, but can you move it? And can you wiggle your fingers? Alright.
Okay, okay. Any new findings that you found?
I don't think so.
Okay. All right, so we'll conclude here and then we're gonna debrief right here in the room if we have the time, right? Do we have the time? Okay, great. Thank you, McGuire. You can relax. You're, uh-huh. Okay, I'm gonna turn it over to our observers here. So you all know who all of us are? Maybe not, we invaded.
So I'm Leanne, I'm the trauma program manager, and my job was to observe your communication, so that's what I was focused on. So, brief, once we got started and you guys got out of that initial shell shock of, oh, we're doing a mock now, then you did a good job of trying to get the patients on the monitor, assessing the oxygen. One opportunity would be to verbalize stuff a little bit more. It took a while for you guys to get into the hang of saying what you're thinking out loud, so it was clear that you were processing. But just from a perspective of somebody observing, you know, you might be thinking something, but your partners might be thinking something else, and you guys
Right.
want to make sure that you're clearly communicating what your thought process is. But once you started doing that, that went well, and you guys spoke out loud. The report to the physician, that was you? That was good, Faith, right?
Yes.
Okay, so good report over the phone. You said the orders out loud.
Yeah.
You repeated them, but one thing you
Yeah.
could have done is say, make a note or
Tell someone to write it
To
down. I just
write
saw
it
you, so I was
down.
like, oh.
I know, I knew, we didn't have like observers for you to know like not to pay attention
Yeah.
to us, but you remembered them, so that
Yeah.
was good. And then you can also then delegate as well too. So we were looking to see if anybody was gonna kind of take that initial lead, and it ended up being you. But just to decrease confusion, you could have said, okay, I'm gonna start the assessment, or I'm gonna do, and it's just that verbalizing out loud, which as nurses that tends to be the one area where, you know, we don't own as well as we probably could. When you started doing the head to toe assessment, engaging with the patient, even though you know it's a mock scenario, but asking him and getting him involved, that was good. Verbalize the need for the patient to go to the OR. And then the only other thing, which isn't communication, and you might speak to that, is head to toe, really is head to toe. So if you do it in a systematic way, then you tend not to miss anything, right? So that was the only piece, because then you can verbalize, all right, I'm assessing his head, and then you can communicate to everybody in the room that you're not finding anything when you're doing each step of the assessment. That was my piece from communication.
Basically, I had about all the same stuff. Yeah, once you got in the groove of things, you know, you were communicating well. Probably could I maybe pick up that he was a really, really sick, decompensating trauma patient a little bit sooner.
Yeah.
And implementing those steps sooner. And keep in mind, your automated machines will overread a hypotensive patient. So if he's really that sick, then perhaps manual should be implemented, because that will overestimate his exact blood pressure if he is that sick.
They just so you know, for the manual blood pressure cuffs, they're in both bedrooms.
Oh.
There are different sizes in both bedrooms.
I'm new, by the way.
Yeah,
So
this
this
is
is
from
from
Mr.
Mr.
Pete
Pete on the
It's
floor.
great, yeah,
That's
it's great.
great.
Yeah.
Got to jump right in.
But yeah, other than that, you know, just maybe picking up more on those hints that your patient's giving you that there is a problem and that's, you know, it's gonna go south pretty quick. Yeah, report to the doctor was great, excellent. And that was, yeah, and really the only thing that he really needed was the volume of speak, so he really needed the blood.
Yeah.
Um,
Used to have that, so.
yeah,
Would-
yeah, cause we don't wanna turn his blood into Kool-Aid.
Yeah.
Which I can't remember which one said it, but I heard them, you guys talking about not waiting for like a type and cross, but to get the emergency release blood. Good job on that. I mean,
I saw some maybe deer in the headlight when we said, what is that process?
I have no idea.
Yeah, and so maybe brushing up on that process, if you need the blood stat or emergent, you know, from the emergency process, what is that process, to get that quickly? But yeah, good job guys, thanks for playing.
Yeah, would it be helpful to kind of, go from ABC, because really we were focusing a little bit on the